Hello. You're here for a full medical examination. We're going to need to do absolutely all we can to analyze and diagnose whatever might be going on in your body. Now, I know that sometimes doctors can make you a little nervous, so I'm going to try and be as gentle and slow as possible. But I am going to need to run quite a few tests on you. So you're going to need to be brave, okay? Let's listen to your heartbeat first. I'm going to use this Littmann stethoscope, and I'm going to listen to your heart and your lungs. The stethoscope might be a little bit cold, but I'm going to place it right here on your chest and listen to your heartbeat. Good. Your heartbeat sounds pretty normal. It's a little bit elevated, but I'm just going to assume that that's because you're feeling a little bit nervous at the doctor. I'm going to listen to your lungs now, all right? I want you to breathe in and out. One more time, in and out. Good. Lungs sound normal. Now, I'm going to have to check your pupils for proper dilation. So I want you to just look straight ahead, all right? Good. Now, I want you to look at my fingers, and I want you to follow my eyes with your fingers. Back and forth. Excellent. I'm testing to see how those pupils are looking, and they seem to be dilating pretty well. Just keep following my finger. Excellent. Next, I'm going to be checking your ears, okay? Now, this is going to be inserted into your ear. It might feel a little tickly, but here we go. Good. You can feel that inside of your ear. And let's do the other ear, all right? Ear canals look pretty clear. Now, I'm going to take your blood pressure with this blood pressure cuff. You're going to feel the compression on the upper part of your arm, on your bicep. It is going to be a little bit tight, and I don't want you to be alarmed by the feeling. Good. That reading wasn't quite accurate. We're going to try it one more time, okay? Good. Blood pressure looks normal. Now, in order to conduct the rest of this exam, we are going to need to wear the proper gloves. Now, these gloves are latex surgical gloves. They're powder-free. So let me know if you have a latex allergy, okay? No? Excellent. Good. Now, what I need to do to fully and completely examine you is I need you to just sit back, and I'm going to do what's called a palpation. So I'm just going to slowly push on the different parts of your body to make sure that there's no abnormalities that I can feel. I'm going to feel the sides of your neck, your lymph nodes, right under your ears. Excellent. I don't feel any swelling. Now I am going to feel the different organs in their place through your stomach. And I'm just going to press lightly on your stomach, okay? Let me know if you feel any pinching or discomfort. Good. From the outside, I don't feel anything wrong. Now, this little neurological tool is going to test your reflexes. So what I'm going to do is just hit it lightly on your kneecap and see if I can get a little twitch, okay? Good. Let's try the other knee. Let's try that again. That's better. Now, I think that one thing that I would like to make sure is that your whole nose and throat system is more cleared out, because I have noticed that you're sniffling a little bit, and so I am going to look inside of your nose, okay? You don't need to do anything, just lay still. Good. Excellent. Let's do your other nostril. Beautiful. Now, what I would like to do is use this little tool, which will send a bit of a shock to different nerves of your body. It's not electric, it's not an actual shock, it's actually just static electricity. So this little thing, when I press this, it's just going to deliver the tiniest little shock, okay? You're going to feel a little bit of jolt, but it's just static electricity. There's no current, all right? So let's just start on your leg. That wasn't so bad, was it? It truly is a bit of static electricity that's created by pushing this plunger. Watch. I'd like to do it on your other side, though, to make sure that all of the nerves on that side of your body are functioning correctly. All right? Good. See, it can be a little bit uncomfortable, but just because it causes discomfort doesn't mean you should shy away from it. Especially in the medical field, we do need to administer some slightly uncomfortable procedures. You're doing an excellent job. Now, I'm going to be using two different kinds of forceps to test the elasticity of different parts of your skin. I don't want you to be alarmed. They're just to see precisely how your body is functioning. Good. Oh, you're doing so well. You have retained pretty good elasticity in your skin, However, I'd like to do a few more tests if that's all right. Good. And now the other side. And now we're going to test both sides at once just to see what the bilateral difference is. Are you ready? Take a deep breath. That wasn't so bad at all, was it? Now, your exam is almost over, but I do want to use one more pair of forceps. These are actually going to go in your nostrils and hold them open while I check out one more thing. Because I don't want you to walk out of here today with an undiagnosed deviated septum. And so I'm just going to insert these medical pliers into your nose and take a deep look, all right? They're not too scary. They won't do any harm. Just take a deep breath. Good. Let's try that one more time. I'm going to shine the light directly into your nostrils. Good. That septum does not look deviated, and I think it's going to be completely all right. Now, I do want you to come back and see me very soon, because I would like to get a closer look inside your mouth. And there's a few other exams that I'd like to subject you to in order to make a full and complete diagnosis. Thank you so much for coming in. You can check out with the receptionist.